going to auscultate the lungs and the heart. I'm going to start with the heart, and I'm going to start listening to the right side at where the elbow meets the ribs. And I'm going to listen to the rhythm to make sure each beat is followed by identical time intervals. And I'm going to move over to the left side. Then I'm going to get a heart rate, so I'm going to count the beats within 15 seconds and then multiply it times 4. Okay, so there was 25 beats within 15 seconds, so the beats per minute is 100. And then any abnormalities that you're going to listen for are swishes between the heartbeats. That would indicate a heart murmur, and then you would report that to the doctor. Next, I'm going to listen to the lungs, and on each side you want to listen to all 9 quadrants that there are. And go over to the other side. Then I'm going to get his respiratory rate. So this is the same thing like the heart rate. You're going to do count the respiratory rate within 15 seconds and then multiply it times 4. Okay, so his was 20. He's mildly panting and sniffing a little bit. So his is about 80. And any abnormalities you're going to listen for are crackles or wheezing. And at that point, you would definitely report that to the doctor. Okay, we're going to get an EEG on this patient. We have her in right lateral recumbency. We have towels between her legs, so her legs aren't touching each other, and so the probes don't touch each other. I'm going to soak her the area of her legs that the electrodes are going to be attached to. So the black is going to be on the front left, and you want to do it 1 inch to 2 inches away from the elbow. And the white is going to be on the front right. Red's going to be on the back left, 1 inch or 2 down from the stifle, and green is back right. Okay, now that we have a consistent rhythm, I'm going to print it, and then we'll take it to analyze it. This is our ECG from our patient. You can see it's very consistent. The beats per minute was 116, which is pretty normal. So now that we know we have a good consistent reading, we're going to take it to our doctor to analyze it. Things they're going to look at are the P, Q, R, S, and T waves. They're going to look at the length and the height of each one of those, as well as the distance between them, to look for any abnormalities there. We could be pretty confident that we didn't have any artifacts on it because we did everything we could to prevent that. We had the pad under her to prevent her from touching the table. We had the pads between her legs to make sure that the electrodes and her legs didn't touch each other while we were getting the reading. If she were to be awake, you would want to keep them as still as possible to minimize any artifacts caused by motion. And any respiratory artifacts can be helped prevented if you move the electrodes distally on the leg. Okay, so I'm going to demonstrate how to use a rabies pole. This is Sam. He is a really friendly dog, but just for the purpose of this video, I'm going to use him. So the rabies pole twists to tighten and release. So I have it loosened up all the way. So I'm going to slip it over his head and then pull back on the pole and then tighten it, twist it to tighten it. So you would use this on any rabies suspect or aggressive dogs to minimize any injury to the staff or the patient. Okay, I'm going to demonstrate free catching urine. We're going to do it midstream to minimize any bacteria that's caught. Come on, team. Okay, I'm going to demonstrate how to properly disinfect and clean a kennel. The majority of our kennels in our animal hospital are stainless steel, but this is a quieter area of the hospital, so I'm going to demonstrate on our cat ward kennels, but you would disinfect just the same. The disinfectant that we use is Vetco pH7Q Dual. This is a germicidal and a disinfectant cleaner and deodorizer. Contact time for this is going to be 10 minutes, so I'm going to spray down the kennel on the inside and the kennel door, let it sit for 10 minutes, and then come back and wipe it clean. So I'm going to spray all sides of the kennel, and I'm going to spray the door carefully, not spraying where any other animals of the in the cat ward are. And then I'm going to set a timer for 10 minutes. Okay, so it's been 10 minutes, so I'm going to come back and wipe it down now. I'm going to give it one more spray just to loosen up that debris. Then I'm going to start at the top and work my way down. And make sure to get the corners and the edges well. I'm going to get some fresh paper towels for the door. Okay, I'm going to get stuff ready to place a urinary catheter to get urine sterilely. I'm going to start by putting out my sterile gloves and creating a sterile field. Okay, so inside here is going to be used as my sterile field. I'm going to get some sterile lube and put it inside my sterile field. And I'm going to get my sterile syringe. And then over here, I have my polypropylene catheter that's been autoclaved, so it's sterile, ready to be used. So that is open, so I can grab that sterilely. Then I have Chlorhex scrub here and water that I'm going to use to prep the prepuce and the penis. And we'll get started. Okay, we're going to start with cleaning the outside of the prepuce with Chlorhex. And then I'm going to just rinse it off with water. Okay, I'm now going to rinse it with this Chlorhex scrub solution and water. And then I'm going to put on my sterile gloves. Alright, and then I'm going to put lube on the end of my catheter. Okay, and I'm going to try to stay as sterile as possible.
He's trying to get it back in.
And then I'm going to put a sterile syringe on it. And stick it directly into a white top tube. On the last part of that urinary catheter video, of course I meant sterile needle, but I said sterile syringe. We're going to do a cystocentesis on Tybalt. We're going to use the ultrasound to assist. So I've got her clipped already, and I'm going to do a surgical scrub with a Chlorhex and alcohol solution, alternating them. And Candace is going to be performing the cystocentesis, and we have a 22 gauge 1.5 inch needle on a syringe here that's sterile. And she's located the bladder on the ultrasound, so she's going to insert the needle at a 45-degree angle. Okay, I'm going to do the ocular testing. The first test I'm going to do is the Schirmer tear test. So I'm going to make sure that this patient has not had any eye medication administered within 2 hours before this test. So I'm going to get sterile Shermer strips, and I'm going to bend these rounded in about 90 degrees before I open the package. And I'm going to open it from the opposite end of where it's bent to make sure it stays sterile. And I'm going to start with one eye at a time, and I'm going to place these on the lower eyelid about half to 2/3 away from the medial canthus. Sadie, oh gosh, I thought you were gonna be good. And since she's being kind of wiggly, we're going to gently just hold this closed for 1 minute. Okay, so in her right eye, it's at about 16, so anything greater than 15 is going to be considered normal. I'm going to do the same thing with her other eye. Okay, and that one was about 15, so that one's still considered normal. Okay, now we're going to do the tonometry. I'm going to start by applying topical anesthetic. We have a tetracaine, so we're going to apply 1 drop to each eye. And while that's setting in, I'm going to get my sterile tip to put into the handpiece. And Christina is going to be careful not to apply excess restraint, especially not to put restraint on the neck or around the eyes. When holding this, you want to keep this horizontal and perpendicular to the eye, and this will light up green when it's at the proper angle. So you're going to keep the probe at about 4 to 8 millimeters away from the eye and centering it in the middle of the cornea. And you want to get at least 3 good readings to average them.
Sadie?
Come on, Sadie.
It's okay, girl. Good girl. Good girl. Good girl. Good girl. It's okay, honey, Sadie. It's okay. There you go. Good girl.
Okay, and hers averaged about 19 on the right eye.
Okay,
And then we're going to do the left one.
Close your mouth. Good girl.
Give it green.
Sadie.
Show it, Sadie.
Okay, girl. Good girl.
And the left eye was about 20. So anything between 10 and 20 is going to be normal. Anything lower than that is going to be typically caused by inflammation, and anything higher can indicate glaucoma. Okay, now we're going to do the corneal staining. I have a sterile strip here. I'm going to use this ophthalmic solution to moisten the strip. And you can either touch the conjunctiva, being careful to avoid the cornea, or you can just let it drip onto the eye.
Okay.
And then we're going to let her blink a few times, or if they won't blink, we'll just gently open and close the eye. And then we're going to use an ultraviolet light to check for any abrasions or any break in the epithelial surfaces.
Turn this way. Look over here. It's okay, Sadie.
So there's no stain uptake on her eye. If there were, you would be able to see the bright green on any ulcers or any other abrasions on there. This is Chipper, and we're going to express her anal glands today. I'm going to start by getting some lube on my finger. I'm going to go in rectally, and the anal glands are going to typically be at 5 and 7. Depending on the size of the dog is going to be how big the glands are if they're full. Hers are about the size of a peanut. And then I'm going to start at the bottom of the anal gland and slowly use my thumb and index finger to kind of work it out of the rectum. That was the left side. Go back and do the right one. Both sides of hers are full. Alright, then I'm going to use these odor eliminating wipes to kind of clean her up a little bit. And then spray a little bit of this odor eliminating spray. Okay, so I'm going to demonstrate how I would be giving an enema. This is Sam. He doesn't actually need an enema, so we're just going to demonstrate how we would give him one if he needed one. So I have some warm water here. You want the solution to be warm, but no warmer than their body temperature. So I'm going to put some lubrication in with the water. And then I'm going to mix it up well. And depending on the size of your patient and what the doctor wants is going to be how much enema you're going to administer. So I'm going to pull up some of my solution here in a syringe. And then I'm going to put some lube on this paper towel to use for the catheter that I'm going to use for the enema. And then once I have that ready, I'm going to put on my gloves. And typically for the larger dogs, we would do this outside or in a run, an area. So when they did pass the bowel movement, it would be in an area easy to clean or easy to examine. Then I'm going to lubricate the end of my catheter well and insert the syringe to the catheter, and then I would insert it rectally and slowly moving it back and forth while administering the enema. And again, depending on the size of the patient, it's going to be how much of the enema we're going to administer. Okay, I'm going to apply a topical medication. Today, Tybalt's going to get Revolution, which is the topical flea and tick prevention. So behind her neck, I'm going to split the hair to part to where I can get to the surface of the skin. And I'm administering it on the back of the neck to prevent Tybalt from being able to lick the medication. Okay, so I've got the hair parted to where I can get to the skin so the medication can get distributed properly. And I'm going to just gently squeeze it out. And that's it. So I'm going to do ear cleaning and ear medicating on Sadie here. We're going to start with ear cleaning. And I'm going to lift up her ear by the pinna and insert the tip of this ear cleaner into the canal. Just give it a small squeeze. And you want to massage the base of the ear to distribute it and to break up any debris or wax that's in there. And then you're going to use a cotton ball or just a little piece of gauze, and you want to wipe up any of the excess around the outside. You don't want to go digging down into the canal. And then I'm going to do the other side. I'm going to lift up her ear to straighten out that canal. Just give it a gentle squeeze. Massage the base of the ear to distribute it and break up any of that wax and debris. And then I'm just going to wipe it out. Alright, now I'm just going to wait for that debris or that ear cleaner to completely dry before I apply any medications to it. Okay, now that the ear cleaner is completely dry, I'm going to medicate her ears. So you're going to apply it in the same way you would do the ear cleaner. This is Positec, so this is a medication we use for yeast and things like that. So you're going to hold up the ear and insert the end of the medication into the canal. Just give it a small squeeze. And then you want to massage the base of the ear to distribute that medication so it works well. And then same thing over here. You're going to hold up that ear to straighten out that canal. Insert the end of the medication syringe down to the ear. Give it a gentle squeeze. And then massage the base of that ear. I'm going to demonstrate how to do ear cleaning on the feline patient, and then after the cleaning I'm going to do medicated treatment. So I'm going to start with the ear cleaner, and I'm going to hold up the ear and insert a little bit of the cleaner into the canal, and then I'm going to rub at the base of the ear to distribute that ear cleaner, and then I'm going to come over it with a cotton ball to wipe out the debris. And then I'm going to wait a little bit for that ear cleaner to completely dry before I administer medication to it. Okay, now that the cleaner has completely dried, I'm going to come back with some medication. This is a in-house mixture that we use. It's going to be an antibiotic and a steroid as well as a ear flush. And I'm going to do 0.5 mLs. And again, I'm going to hold up the top of the ear to where that canal straightens out some. I'm going to slowly administer the medicine and then squish around to make sure that medicine's getting distributed properly. Okay, I'm going to demonstrate how to give subcutaneous fluids. I have warm LRS fluids here with a sterile syringe and a sterile needle. I'm going to tint the skin above the shoulder blades and putting the needle in at a 45-degree angle, being sure to not go in the muscle or in the dermis. I'm going to draw back the syringe to make sure I'm not in any vessels, and then administer the fluids. And then I'm going to pinch the skin to hold it off to make sure none of the fluids come out and that hole seals up. Okay, now I'm going to do a nail trim. With the canines, you Want to do it at about a 45-degree angle, and at the bottom of the nail there's kind of this little groove that you aim for. And you can kind of see this little black circular area that is an indication that you're close to the quick. So once you get to that, you want to stop. If we were to quick her, we do have some quick stop here that we could use. It does have a numbing agent in it, since it can be painful. And she does not have a dew claw. So this is Tybalt, and we're going to do a nail trim on her today. Doing the nail trim, you want to kind of go at a 45-degree angle like it shows in this picture. Be careful not to get the quick. If you were to get the quick, we do have some quick stop. It's a powder that has a numbing agent in it, since it can be kind of painful. So Michaela's going to kind of hold the foot up for me, and I'm going to push on the paw pads a little bit to get those nails to come out. And again, at the 45-degree angle, being careful not to get to her quick. Okay, so I'm going to apply a bandage like if this were to be an emergency laceration, like if she were to get hit by a car or in a car accident and she were to have a laceration. So I'm going to use a sterile Teflon pad, wearing gloves to prevent any contamination. So I'm going to put Teflon pad on with a stack of gauze over it, and then I'm going to vet wrap around it. And I want it tight to prevent any bleeding, but I don't want to compromise any of her organs. So we would do a bandage like this just to kind of hold her over until one of the doctors could get a good look at her. There we go. I'm going to place a modified Robert Jones bandage and a splint as well. The modified Robert Jones bandage is used for compression for after surgery, and then the splint is going to be used for distal limb fractures. So I'm going to start by placing my stirrups on the 1/3 distal end of the leg. And I'm going to use this tongue depressor to attach to each piece of this white tape. And then for the purpose of the video, if she were to have surgery, I would place a piece of gauze on the surgery site. And then I'm going to start with cast padding, and I'm going to start just above the toes. You do want to make sure the tip of the toes is outside of the bandage so you can observe it for any swelling. And I'm going to wrap overlapping about 50%. Making sure not to have any creases in the bandaging. We're going to do 2 layers of the cast padding. Then we're going to use the conforming gauze, wrapping the same way, starting at the same spot at about 50%. This one you want to do lighter because it is for compression. And for the purpose of this video, if we were going to be placing a splint, this is where we would be doing it now. And you're going to continue to wrap that second layer of the conforming gauze over the splint. And then I'm going to apply the stirrups. I'm going to turn it towards the bandage, and this kind of just keeps it in place without it slipping. Okay, then I'm going to apply a light vet wrap, being careful not to touch the skin with the vet wrap. Just lightly wrap it about 50%, just like the other bandages. And around at the top of the splint, we added some extra padding just for comfort so it does not rub the leg. Okay, and to remove it, you're just going to slowly cut layer at a time. So I'm going to start with this vet wrap. Take out the splint. Okay, I'm going to do 2 dental x-rays. I'm going to start with an x-ray of the bottom incisors. So I have my plate in there flat side up, and I'm going to kind of go at a 90-degree angle with the plate. Okay, now I'm going to get the premolars on the left side. So again, I have the flat side up, and I'm going to go at a 90-degree angle with the plate. Okay, I'm going to do hand scaling. I'm going to use a curette. This is used for subgingival scaling and supragingival scaling. So I'm going to go gently under the gum line, making sure that the blade of the curette is at a 45 to 90 degree angle, and gently make strokes down the crown of the tooth. Okay, I'm going to do ultrasonic scaling. You want to make sure you have a fine mist to prevent any overheating. You want to gently apply pressure with the side of the scaler, being sure to keep it moving and do not keep it on the tooth longer than 10 to 15 seconds at a time. Okay, now I'm going to polish. I'm going to make sure I have my slow speed handle with a fresh poly cup on it with some paste. I'll make sure I have plenty of paste. Polishing is going to smooth any pits or scratches caused by scaling. So I'm going to make sure I apply gentle pressure to flare the end of the poly cup to make sure it gets under the gum line. And I'm not going to keep it on the tooth more than 5 seconds, but I want to make sure I get all I want to make sure I get the full surface of the tooth. Okay, so Sadie had her dental cleaning today. First thing we did was the pre-surgical blood work, and everything was within normal range. During her dental today, she did have an extraction of a tooth that was fractured and had some pulp exposed. And it is one of the larger teeth that she does use to chew. So you're going to want to soften her food for 5 to 7 days. Tonight, since she was under anesthesia, you want to offer half of her normal amount, but you want to continue the regular feedings tomorrow. For her go-home medication, we are sending home an anti-inflammatory pain medication. You're going to give half tablet every 24 hours. And then we're also sending home some antibiotic to give 1 capsule every 12 hours. And we are going to send you home with some samples of different daily treats to use to help with any tartar buildup or to prevent it. We're going to send home brochures with these as well. We're sending home a sample of the Hills Prescription Diet TD. You can give that to her and see how she likes that. We do recommend a dry kibble because it helps prevent more tartar buildup than the wet food does. We're also going to send you home with a toothbrush. Daily brushing is recommended, but even as little as 3 times a week is very helpful. So when you brush the teeth, you want to do it at a 45-degree angle and do circles, and you only have to do the outside of the teeth. The tongue helps prevent tartar buildup on the inside.